Hello everyone, my name is Dr Parissis. You may have seen some of my previous videos where I gave advice about hair loss treatments and hair transplant surgery. In this video, I want to talk about something else. I want to talk about how I got my hair from this to this. Now, one of the main reasons why I'm so interested in hair loss treatments is because I've experienced hair loss myself. I've said this in a few previous videos, and it has allowed me to combine my medical background with my own personal experience. This means that I am so hungry for new hair loss treatments and new advances in hair transplant surgery. I started experiencing hair loss around about the age of 21 years old. And I remember the first time I was in a lecture in medical school, and one of my friends said that he could see some of my scalp through my frontal region of my hair. He suggested that I might be losing my hair and I might want to do something about it. And I actually was, I was very distraught by this. I'd never thought about my hair even, being lost at all. Certainly not at such a young age. I became very concerned, very worried about it, as many hair loss patients first experience, and I wanted to do something about it straight away. So I did a lot of research, and I looked into some of the medical therapies. Again, as with every medical treatment, it's best to go up the ladder of treatment. So firstly, started off with conservative measures. So I looked into vitamins, oils, things like rosemary oil, biotin. I took those for a little while. I was expecting big changes, but of course, unfortunately, these things don't result in dramatic changes. So then I moved up the treatment ladder to medications. I started on minoxidil first because I didn't want to commit to the side effects of finasteride. So I took minoxidil for about 6 to 9 months, and I felt then that my hair loss was actually worsening. I was becoming really obsessed with this. I was starting to become very self-conscious and very worried that people were noticing it, and more people were noticing it. I opened up to the people close to me, but I was quite embarrassed about this, and I really wanted something to be done about it. I just wanted it over with. I didn't want my brain, I didn't want my mind to be thinking about it all the time like I was during that time. So I started taking finasteride. I realized after 2 years that my hair loss actually continued on finasteride. Finasteride did slow it down. I noticed that the thinning was just happening at a slower rate, but it didn't stop it once and for all. And I just wanted the frontal portion of my hair back. I still had a strong central tuft, as you can see here, which is really common. For reasons we don't yet know, the central tuft is less sensitive to DHT, the hormone that causes hair loss, whereas the temples here are very sensitive. And so, unfortunately, those temples they were thinning. I was becoming very self-conscious about this. My father does have severe male pattern baldness. He's about 60 years old and he's lost about 80% of his hair. So I knew it would happen to me at some point. I just didn't expect it to happen to me so young. I wanted a permanent solution. I wanted to get rid of my worry about side effects of finasteride, about whether I was on the right dose, about whether I should be implementing other medical therapies. I wanted to not have to look in the mirror, almost every day and worry about this. I wanted a permanent solution, and the only permanent solution I could find was a hair transplant. So I did a lot of digging, and I looked into the different types of hair transplants, A, FUT, and B, FUE. And I looked at the pros and cons of each, and I realized that because I'd started my hair loss journey at such a young age, it's likely that more hair would be lost. So looking into things, I realized that there was really only one way to make sure that I wasn't bald for the rest of my life. I mean, why do I even care about being bald? I think it's because my hair has been so part of my identity for so long. Hair is a unique thing. It's not quite like, wrinkles or changes, natural age-related changes to the face. I think when someone gets older and their face changes due to age, I think they still look like themselves. I still think that they have their identity. But hair loss, I think there's something different about it. And I know a lot of patients agree with me, and certainly Dr. Feller and Dr. Bloxham agree with me, that hair is a significant part of someone's identity. You don't quite look like yourself without your hair. And that's all I really wanted. That's why I'm really passionate about the term hair restoration, as opposed to And looking at it from any other perspective, seeing it as plastic surgery. I personally do not consider myself a plastic surgeon. I do see it as restoration, because you are simply restoring or bringing your hair back to what it was when you were, say, a teenager. So I'm really passionate about this. So moving forward, I looked around and I realized that the results were night and day between Dr. Feller and Dr. Bloxham's results and everyone else's. And I also was really passionate about having a donor area supply that would last a lifetime, because, as I said, I wanted to keep hold of my hair for as long as possible. And so I went to Dr. Bloxham 2 years ago now, and I had an FUT or strip procedure where 2,300 grafts were taken from the back of my donor area around here. The procedure itself was relatively painless. With local anesthetic, I wasn't able to feel anything that was being cut or removed. And a few days after the procedure, I had mild pain, but nothing that didn't go away after 3 to 5 days. And then I went about my way, and if you've had a hair transplant, you'll know and share my pain that the most painful part of a hair transplant journey is the impatience, is the difficulty waiting for your result. You become so impatient because you just want those results straight away. And unfortunately, they do take about 6 to 12 months to come, and that was the case with me. However, I was astounded with my results. So specifically, this is my results after 6 months. You can see there's almost full restoration of my hairline. We decided to go relatively conservative with my hairline design, but because I'm still young, we didn't go too conservative. You can see that Dr. Bloxham was able to maximize the density with just 2,300 grafts. And with strip surgery, the growth of grafts is, from our experience as a hair transplant surgeon myself, that has worked with Dr. Bloxham for at least 2 years now, we have seen that the growth between FUT and FUE in the average patient is just so much more. And I'm a perfect example of this. Look how much growth I was able to achieve in just 6 months. After 14 months, my hair was better than it has ever been. And I was styling it because I was, of course, enjoying it. And I have been enjoying it since. As you can see now, I'd like to think that I've got a natural result. I do take finasteride to prevent continued loss. And I'm open to the idea of possibly needing another procedure in the future. But I'm able to because I went for strip surgery, meaning I can have another one or I can have FUE at any point. So I'm in a good position and I'm happy with that. I do have aggressive male pattern baldness. As I said, my dad has severe loss, and so I expect further loss down the line. But I think that I am in a good position, and I hope that I won't have to deal with being bald, hopefully at any time in my life. I will always be interested in the medication approach, but I do have a passion for hair transplant surgery because it has allowed me to feel so much better in my own skin. If you're interested in a hair transplant, reach out to me. We can go through some photographs, analyze your genetics, analyze how likely you are to lose your hair, and see whether you might be a candidate for surgery. Reach out to me at drparissis@gmail.com, and thanks for watching my video.